What is high blood pressure? First, let's define high blood pressure. High blood pressure or hypertension is when your blood pressure, or the force of your blood pushing against the walls of your blood vessels, is consistently too high. Now, how does your blood pressure and circulatory system work? In order to survive and function properly, your tissues and organs need the oxygenated blood that your circulatory system carries throughout the body. When the heart beats, it creates pressure that pushes blood through a network of tube-shaped blood vessels, which includes arteries, veins and capillaries. This pressure, the blood pressure, is the result of two forces. The first force is the systolic pressure that occurs as blood pumps out of the heart and into the arteries that are part of the circulatory system. The second force is the diastolic pressure. It is created as the heart rests between heartbeats. These two forces are each represented by numbers in a blood pressure reading. When does it cause harm? The damage starts in your arteries and heart. The primary way that high blood pressure causes harm is by increasing the workload of the heart and blood vessels, making them work harder and less efficiently. Over time, the force and friction of high blood pressure damages the delicate tissues inside the arteries. In turn, LDL, or the bad cholesterol, forms plaque along tiny tears in the artery walls, signifying the start of atherosclerosis. The more the plaque and damage increases, the narrower or smaller the insides of the arteries become, raising blood pressure and starting a vicious circle that further harms your arteries, heart, and the rest of your body. This can ultimately lead to other conditions ranging from arrhythmia to heart attack and stroke. High blood pressure is a silent killer. You may not feel that anything is wrong, but high blood pressure could be quietly causing damage that can threaten your health. The best prevention is knowing your numbers and making changes that matter in order to prevent and manage high blood pressure. How high blood pressure is diagnosed? The best way to diagnose high blood pressure or hypertension is to have your blood pressure measured. How a blood pressure test works. A blood pressure reading is taken with a pressure cuff or sphygmomanometer. During the test, the cuff is placed around the upper arm before being manually or electronically inflated. Once inflated, the cuff compresses the brachial artery, momentarily stopping blood flow. Next, air in the cuff is slowly released while the person performing the measurement listens with a stethoscope or monitors an electronic readout. Your blood pressure reading is recorded as two numbers. The systolic blood pressure is the top number that indicates how much pressure your blood is exerting against your artery walls during heartbeats. Diastolic blood pressure is the bottom number that indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. American Heart Association or AHA recommendations are: if your blood pressure is normal or less than 120/80 mmHg, your blood pressure should be screened during regular healthcare visits yearly for anyone 20 years of age or older. If you are diagnosed with high blood pressure, your doctor may recommend monitoring your blood pressure numbers at home in addition to your regular healthcare visits. And your doctor will also likely recommend a treatment plan that includes lifestyle changes and, if needed, will prescribe certain medications. Understanding blood pressure readings. What do your blood pressure numbers mean? The only way to know if you have high blood pressure or hypertension is to have your blood pressure tested. Understanding your results is key to controlling high blood pressure. Your blood pressure numbers and what they mean. Your blood pressure is recorded as two numbers. Systolic blood pressure is the first number that indicates how much pressure your blood is exerting against your artery walls when the heart beats. While the diastolic blood pressure is the second number that indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. Now, which number is more important? Typically, more attention is given to systolic blood pressure or the first number as a major risk factor for cardiovascular disease for people over 50. In most people, systolic blood pressure rises steadily with age due to the increasing stiffness of large arteries, long-term buildup of plaque and an increased incidence of cardiac and vascular disease. However, either an elevated systolic or an elevated diastolic blood pressure reading may be used to make a diagnosis of high blood pressure. According to recent studies, the risk of death from ischemic heart disease and stroke doubles with every 20 mm Hg systolic or 10 mm Hg diastolic increase among people from age 40 to 89. Why blood pressure is measured in mmHg? The abbreviation mmHg means millimeters of mercury. Mercury was used in the first accurate pressure gauges and is still used in medicine today as the standard unit of measurement for pressure. Healthy and unhealthy blood pressure ranges. There are 5 blood pressure ranges as recognized by the American Heart Association, and these are: normal. Blood pressure numbers of less than 120/80 mmHg are considered within the normal range. If your results fall into this category, stick with heart-healthy habits like following a balanced diet and getting regular exercise. Elevated. Elevated blood pressure is when readings consistently range from 120 to 129 systolic and less than 80 mmHg diastolic. People with elevated blood pressure are likely to develop high blood pressure unless steps are taken to control the condition. Hypertension Stage 1. Hypertension Stage 1 is when blood pressure consistently ranges from 130 to 139 systolic or 80 to 89 mmHg diastolic. At this stage of high blood pressure, doctors are likely to prescribe lifestyle changes and may consider adding blood pressure medications based on your risk of atherosclerotic cardiovascular disease, such as heart attack or stroke. Hypertension Stage 2. Hypertension Stage 2 is when blood pressure consistently ranges at 140/90 mmHg or higher. At this stage of high blood pressure, doctors are likely to prescribe a combination of blood pressure medications and lifestyle changes. Hypertensive crisis. This stage of high blood pressure requires medical attention. If your blood pressure readings suddenly exceed 180/120 mmHg, wait 5 minutes and then test your blood pressure again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. If your blood pressure is higher than 180/120 mmHg and you are experiencing signs of possible organ damage such as chest pain, shortness of breath, back pain, numbness, or weakness, change in vision or difficulty speaking, do not wait to see if your pressure comes down on its own. Call emergency hotlines. Things that raise your blood pressure. Keeping blood pressure under control can mean adding things to your life, like exercise, that help lower it. It can also mean avoiding things that raise it. Here is a list of blood pressure raisers, and information on how to keep your pressure from getting too high. Decongestants. People with high blood pressure should be aware that the use of decongestants may raise blood pressure. Many over-the-counter cold and flu preparations contain decongestants. Salt. The American Heart Association recommends no more than 2,300 mg a day, and an ideal limit of no more than 1,500 mg per day for most adults. Alcohol. If you drink, limit your consumption to no more than 2 drinks per day for men, and no more than 1 drink per day for women. Hot tubs and saunas. People with high blood pressure should not move back and forth between cold water and hot tubs or saunas. This could cause an increase in blood pressure. Weight gain. Did you know you may experience health benefits from losing as few as 10 pounds? Sitting. Just a few minutes of light activity, for people who sit most of the day, can lower blood pressure in those with type 2 diabetes. Health threats from high blood pressure. High blood pressure threatens your health and quality of life. In most cases, the damage done by high blood pressure or hypertension takes place over time. If left undetected or uncontrolled, may lead to heart attack, stroke, heart failure, kidney diseases, vision loss, sexual dysfunction, angina, or chest pain, and peripheral artery diseases. Can hypertension cause other problems? When your blood pressure is too high for too long, it damages your blood vessels, and LDL, or bad cholesterol, begins to accumulate along tears in your artery walls. This increases the workload of your circulatory system while decreasing its efficiency. As a result, high blood pressure puts you at greater risk for developing life-changing and potentially life-threatening conditions. 5 simple steps to control your blood pressure. Your HBP deserves your attention. Uncontrolled high blood pressure or hypertension can be fatal. If you've been diagnosed with high blood pressure, these 5 simple steps can help you keep it under control. Know your numbers. Most people diagnosed with high blood pressure want to stay below 130/80 mmHg, but your healthcare provider can tell you your personal target blood pressure. Work with your doctor. Your healthcare provider will help you make a plan to lower your blood pressure. Make a few lifestyle changes. In many cases, this will be your doctor's first recommendation, likely in one of these areas. Maintain a healthy weight. Strive for a body mass index or BMI between 18.5 and 24.9. Eat healthier. Eat lots of fruit, veggies, and low-fat dairy, and less saturated and total fat. Reduce sodium. Ideally, stay under 1,500 mg a day, but aim for at least a 1,000 mg per day reduction. Get active. Aim for at least 90 to 150 minutes of aerobic, and/or dynamic resistance exercise per week, and/or 3 sessions of isometric resistance exercises per week. Limit alcohol. Drink no more than 1 to 2 drinks a day. And 1 for most women, 2 for most men. Keep checking your blood pressure at home. Take ownership of your treatment by tracking your blood pressure. If you have to take medication, take it exactly the way your doctor says. Thank you for watching. Please don't forget to subscribe to my channel, and press the tiny bell button for video updates.